Navigating the cost of care in our healthcare system is often confusing and frustrating.
A local mother reached out to us today saying a billing mix-up cost her teenage son more than $1,000. She still can't get a refund, so she contacted Denver 7, and we sent Denver 7 Sloan Dickey to get answers.
He called and said, I am really struggling.
During an emotionally difficult year in 2020, this mother tried to help her son who was beginning to experience anxiety.
We knew he was struggling and he needed support.
She asked to stay anonymous to protect her son's privacy, but says her son was referred to the University of Colorado Depression Center for online therapy sessions. She says the visits worked.
He's doing so much better. He's doing amazing.
Her insurance company, Anthem, told her that virtual visits with psychotherapists are covered by her healthcare plan.
I believe it was COVID related. The Anthem and my employer said, okay, if you need mental health visits, because a lot of people did during COVID, that we will cover it 100%.
But it came as a shock when her son started getting charged for the visits.
In October, we started getting bills for those visits.
She says the CU School of Medicine billed her insurance company for in-person visits that were not covered in her plan, even though all of her son's visits were online.
They were $144.67 a visit, and there was 11 visits that were billed incorrectly.
More than $1,500 in bills sent directly to her son.
He's 19. He's receiving all of these invoices for medical services, and he's like, I don't have the money to pay this.
She said she tried to fix the problem with the hospital.
I would guess it was a medical coding error, but resolving it with CU has been really difficult.
When we contacted Anthem, a representative said in a statement the claims were likely erroneously submitted and they need to be corrected before the billing can be fixed. A representative for CU Medicine declined to comment for the story.
I just want to emphasize that people should check if they're being billed by a medical provider, check to make sure that the bills are correct.
She says she's asked CU for months to change the billing to reflect the virtual visits, but hundreds of dollars in charges remain.
People should be aware of how medical fees are being charged and if they're being charged correctly.
The good news is her son is better, but her fight over the billing continues. Sloan Dickey, Denver 7.
And we took a deeper look at what you should do if this should happen to you. And the big thing is, don't be afraid to ask questions. And because Colorado law doesn't protect everyone or every situation, here's some things to keep in mind. Always check with your insurer to make sure that you are choosing a provider that will be covered, including the hospital, the lab, or healthcare facility. And if you have to have surgery, even if the facility is in network, check with that facility to make sure the surgeon, anesthesiologist, and surgical assistants are also in network. And in the case of an emergency, know where the nearest in-network ER is.